Hi, this is Dr. Andre Jones with Inspired Dental, and today we're going to talk about gingivitis and what exactly does that mean. So stay tuned and get informed. So what exactly is gingivitis? What does that mean? So, and something, how does that differ from gum disease, also known as periodontitis? So to break up the words, so gingiva means gums, and itis means inflammation or disease of the gums. And so gingivitis is where we're having just the early inflammation of the gums. That's where we could have some redness. Maybe it bleeds a little bit when we either we floss or when we brush our teeth. When we go in as a dentist and go and we measure the gums, we'll get some bleeding as well. And what it means is that the bacteria are forming, they like to form little colonies around your teeth, around the gum area. That's called plaque. It's the sticky white stuff. Well, that sticky white stuff, as it sits there, it starts to eat away at the gums. And that's why we'll get early inflammation, which is the redness that we see. And so that is what gingivitis is. Now, periodontitis is where we start to venture in, where it starts to move under the gums. And as it goes under the gums, now it starts to eat away at the bone. And when it starts to eat away at the bone, that's when it becomes full-on gum disease, periodontitis. And so I hope that helps in describing the differences between the two and exactly what gingivitis is. So the first symptoms of gingivitis that we want to look out for are that redness and bleeding when we start to either brush or floss. Like I said, bleeding is the first sign. So for example, if I get a wound on my arm and I have a scab, well, if I brush against that scab, well, the scab comes off, it bleeds. Well, but if I have healthy skin and I do the same thing, if I scratch it or if I brush it, it doesn't bleed because my skin is healthy. So same thing with our gums. A lot of times people will think, oh, I'm bleeding, I must be brushing too hard, or oh, I bled because the dentist poked me with that instrument, the pokey instrument. And it's like, well, no, because if it's healthy, just like with our skin, it's not going to bleed. So it only bleeds when there's something unhealthy there. And I always like to give the the illustration. It's like almost like the bacteria are like a leech, and they're eating away at the gums. And so if you've ever seen a leech being removed from the skin, it's like, well, you don't want to leave the leech there because it's bad, right? It's sucking your blood. Well, but when you remove that leech, it bleeds, but it needed to be done so it could heal. And so the same thing if we brush our teeth and we notice that it bleeds, we're actually removing the plaque that is actually eating away at the gum. It does bleed for a moment, but if you keep up with that, it will actually eventually heal. And so same thing when we go in and we measure with our tool, we're removing a little bit of the plaque when we go in with our tool, it bleeds. And so I say, so that's the first and most early sign. At this stage of disease, it's not painful, right? So we don't notice it. And so that's why it's important that if we see these early signs of redness or bleeding when we brush or we probe, we need to make sure we address it right away because it will lead to more advanced disease later. Question we get asked is, well, doctor, like how dangerous is gingivitis? And like I said, like gingivitis is the start of the disease. It's like someone coming in to a doctor and they're being told, okay, they have the early signs of cancer. Well, let's treat it before it becomes cancer, right? Well, same thing with the gingivitis. That's the start of the full-on periodontitis gum disease. So let's treat it before it becomes full-on gum disease, where we start to have bone loss and bone destruction and eventually tooth loss, right? So gingivitis in itself is not a very destructive disease, but it's the start of a path that will be much more destructive. So it has to be dealt with early. So a question people will ask me is like, well, can I have gingivitis and periodontitis at the same time? So when we go through your gum measurements, it's we're going to measure different areas. We might have some areas that are healthy. Oftentimes it's the front of the mouth because it's the easiest to access. And then we might have areas that are unhealthy. Most often it's the back of the mouth where it's harder to access, harder to floss. So even though the mouth is split up where some areas could be healthy or some areas are not as worse as other areas, whatever areas are the worst, you end up getting classified as that. So we're not going to have areas that are just, oh, this area is just gingivitis and this area is just, periodontitis. Whatever is the worst area, you end up getting classified as that, medically speaking, and then we treat you for that because If you have that disease in one area, that means all other areas are just as susceptible. It just hasn't happened just yet, but you give it time, it will happen. And so, so you can't be diagnosed with both diseases at the same time. It's one or the other. If someone has gingivitis, how do we treat it? Well, we treat it by doing a cleaning. And so we actually have there's actually a specialized type of cleaning called a gingivitis cleaning, where we do go under the gums. We're not going so deep that you have to be numbed or we're going down to your bone, but we are going under the gums, just below where the plaque would rest. And that way we can make sure we're cleaning everything super thoroughly, and that way things will heal back to healthy and normal. And then we actually do a follow-up to make sure, is it stable? Because like I said, we want to make sure it does not progress to full-on gum disease. So it's very important that we address it at this stage. And so, and then we track it to make sure it becomes stable. And if it does become stable, well, good news, now you get to have a regular cleaning, because that's our ultimate goal, is to get everyone to the point where they can have just regular cleanings. Because one, most insurers cover it completely, so it's less out of pocket. And two, it's just more pleasant, and it means we're healthy, right? And so, and our goal is to get you healthy. And so part of getting someone to a regular cleaning is really we're getting them to that point, because that means they are now healthy. A question that is often asked, well, how long does it take to cure gingivitis? Well, gingivitis is, unfortunately, there's not necessarily a cure for that disease. Some people tend to be more susceptible to gingivitis and gum disease because it has to do with the type of bacteria in their mouth. Now, there are treatments and things that we can prescribe to help, change that bacteria, that can help improve it. But if someone has that bacteria, we gain our bacteria kind of partially genetically, and also that comes from our family exposure throughout our life. And so, but the good news is we can return the gums to a stable state where the bacteria goes into remission. Remission means that it's dormant, it's not active, and as long as a person does good maintenance at home, they use the mouth rinses we prescribe, they use the probiotics that we recommend, and then they keep up with their brushing and their flossing. If someone does those things, well, then it will stay in remission, it will stay dormant, and that way it can maintain and be healthy. So that's usually the process in treating this. And like I said, unfortunately, there's not just a cure of disease for, an absolute cure for this where, oh, I never have to worry about it again. It does take maintenance, it does take continued work at it, but as long as those things are done, it will stay gone away. Thank you so much for your attention in this video regarding gingivitis. I hope it was informative and very helpful to you, and it can help you kind of supply you with some of the tools to prevent this for yourself. If you have questions, feel free to give our office a call at 210-734-5092. You can also request an appointment on our website, which is inspiredentalsa.com. The links are provided for you, so you can go and request an appointment there or find out more about our office, find out more about gingivitis. We are here to help answer any questions you have and see you to a life of vitality and wellness. So we look forward to hearing from you. Please give us a call. This is Dr. Jones signing out. Thank you.